Arthroplasty. After my elbow injury, I had to get arthroplasty to repair the damage. Gastralgia. I had gastralgia after eating too much at the restaurant last night. Cardiomegaly. When the doctor got my chest x-ray back, he pointed out I had cardiomegaly. Rhinorrhea. During the season changes, I get bad rhinorrhea and sinus inflammation. Hemostasis. It is imperative to keep the patient at hemostasis so they don't bleed out during surgery. Dysphagia. I went to the doctor after a week of dysphagia with dry foods. Cephalalgia. My doctor told me my cephalalgia could be caused from the stress of my job. Osteotomy. The orthopedic surgeon recommended an osteotomy to realign the patient's knee. Adenopathy. After doing a physical exam, my provider said they were concerned about some adenopathy around my neck. Arteriostenosis. The patient's chest pain was traced back to arteriostenosis, which was reducing blood flow through a major artery. Carcinogenesis. Exposure to certain chemicals can accelerate carcinogenesis by damaging cellular DNA over time. Hemiplegia. After her stroke, the patient developed hemiplegia on the left side of her body. Bronchoscopy. The pulmonologist performed a bronchoscopy to examine the patient's airway. Pancreatoma. The imaging revealed a pancreatoma, prompting the team to decide whether removal was necessary. Gingivectomy. The periodontist recommended gingivectomy to remove excess gum tissue. Narcolepsy. Because of my narcolepsy, I would constantly suddenly fall asleep in class. Ischema. No. Ischemia. Final answer. The surgeon acted quickly because prolonged ischemia could cause permanent damage to the patient's heart. Bruit. During the exam, the physician detected a bruit over the corroded artery. Adipocyte. Researchers observed the size of each adipocyte increase significantly in response to a high-calorie diet. Anhidrosis. Because of his anhidrosis, he was at high risk of overheating during exercise. Ecchymosis. After a minor injury, a large area of ecchymosis formed on my forearm. Gastroplagia. The patient's severe nausea was traced back to gastroplagia, which slowed the stomach's ability to move food forward. Presbycusis. My grandma had to get hearing aids due to her presbycusis. Parastasia. After laying on my arm too long, I began to experience parastasia. Positron emission tomography. Positron emission tomography is used to create detailed 3D images of the human body. Splenorexis. Following a traumatic injury to the abdomen, the patient was diagnosed with splenorexis. Hyperstasia. The patient had hyperstasia in her fingertips, making it hard for her to do everyday tasks. Colopathy. After reported changes in bowel habit and abdominal pain, the doctor suspected colopathy. Hemolysis. Sorry, hemolysis. Final answer. During the blood transfusion, the patient experienced a severe reaction resulting in rapid hemolysis. Retinopathy. After developing retinopathy as a result of diabetes, The patient's vision became worse.